Welcome to the HeartKids podcast. My name is Tahnee Jash. I'm a proud Yuin Kamilaroi woman and a journalist. I was also born with a heart condition. I'll be presenting a series of episodes looking at Aboriginal and Torres Strait Islander people's experiences of childhood heart disease. This episode, we have the privilege of chatting with Jayhrani Nicholls, a registered nurse and Aboriginal woman who works at Ngak Min Health, located on the Djarragun College campus in Gordonvale. With a passion for empowering individuals to take control of their own health, Jayrahni has been dedicating her skills and expertise to support patients with rheumatic heart disease.
Being at uni for 4 years, doing my nursing, I did not once hear about rheumatic heart disease. And then coming here and finding out that this affects my people, it was quite, what can I do as a nurse to help these young kids better their health or, live a longer, happy life?
Before we begin, we'd like to acknowledge that this podcast is being recorded on the land of the Gadigal people of the Eora Nation, otherwise known as Sydney. We acknowledge the traditional custodians of this land and the land that you're listening in from today. We pay our respects to elders past, present and future, and pass that respect on to any Aboriginal and Torres Strait Islander listeners. Thank you for coming and joining us on the podcast this afternoon. How are you going?
Yeah, good. Thanks for having me. A bit nervous, but
don't be nervous.
I can answer these questions.
Don't be nervous. I'm friendly, I promise. Before we get started, I like to ask our guests, where they're dialing in from, what country you're coming to us from, and a little bit about who you are and where your mob is from.
Yep. So my name's Jayhrani Nicholls. I was born and raised in Alice Springs. So that's where my Aboriginal comes from my mother's side. My dad identifies as Torres Strait Islander, so his parents were born up in TI.
So did you grow up in Alice Springs and then you moved to Gordonvale where you're working now? How did that sort of come about?
So I lived in Alice Springs until I was about 12. Then we moved to Mackay for a bit, and then my family moved me to Cairns. And then since then did my year 12, went to JCU, did my nursing, and then, working at Ngak Min Health.
Oh, lovely. And Ngak Min Health is, as I mentioned before, is in Gordonvale, which is near the Aboriginal community called Yarrabah, if I'm correct. Can you tell us a little bit about Ngak Min Health and the work that you do there and the impact it has being on Djarragun College?
So Ngak Min Health is a very small health clinic that sits on Djarragun College campus. We're very separate to the campus, we're like any other health organisation, but we do mainly focus our care on the students that attend Djarragun College. We also do see community people as well. We're slowly opening the doors for community, but having the clinic on the school grounds of Djarragun College where we've got kids from the Northern Territory, very remote communities like Yuendamu, Mirrawinny, and like all the communities up to the Cape, Arakoon, Cowan, TI, all those little islands up there. So having the clinic where these kids can jump out of bed and go straight to the clinic when they're sick. A lot of these kids have never been to a health service or seen a doctor. It's amazing to see that they get the health that they need while they're at school.
How many kids would you say are at college? Is there quite a large number of children?
I think the number is roughly around 300, but that's also including boarders and day students. So it's a mixture.
Yeah, right. And I was having a little read on the website about some of the work that Ngak Min Health does. And there was a statistic on there that really sort of stood out to me, which was, 10% of the children that come to the centre already have a chronic diagnosis. And so I was really keen to hear from you about the importance of the work that Ngak Min Health are doing and the flow-on effect that has for families and, the children that go to the school, but also the community that lives in the area.
I feel like a lot of these kids all have chronic conditions, whether it's diabetes, whether it's rheumatic heart disease. But when they come to Djarragun College and see our doctors at Ngak Min Health, we're able to start them on a health assessment where we can make sure what is their basis of their observations. Then we're able to refer them to all their other specialty appointments, whether that is to see a cardiologist, whether that is to see a podiatrist or a diabetes educator. At least we're able to get them in the right steps because the kids in community may not have seen a special doctor in community. So being able to get their foot in the door to see those special doctors it's amazing.
Yeah, definitely. And I think the point around some children not even being, having access to doctors or specialists is one of the big takeaways there, and why the work that you're doing is really important. And your work, your role, so you're a Aboriginal nurse and health worker. Can you tell me a little bit about your work and the work that you do, and sort of the focus that you have around rheumatic heart disease? As I understand, that's a sort of specialty area, or service that you provide to the community, service that you provide to people specifically with rheumatic heart disease.
So my role at Ngak Min Health, it's quite a massive role. So I'm the one that conducts the health assessments on every kid that walks through Djarragun's door. I take every kid to the dentist. I make sure all the kids' immunisations are up to date, matching the national immunisation schedule. So a lot of these kids aren't even up to date with their Year 7 immunisations or Grade 10 immunisations. So that's a big job in itself. I'm helping our nurse practitioner and doctors manage and treat the kids with chronic conditions. But also since being at Ngak Min, I've taken on the role of being the RHD nurse, I guess. So my nurse practitioner trained me very well to administer bicillins, because I was very nervous. Being at uni for 4 years, doing my nursing, I did not once hear about rheumatic heart disease. And then coming here and finding out that this affects my people, it was quite, what can I do as a nurse to help these young kids better their health, or, live a longer, happy life? So yeah, rheumatic heart's definitely been something that I've been passionate about in the last 3 years. And yeah, I want to make a difference in these kids' lives.
And is that where your inspiration sort of stemmed from, in wanting to get into working with people who are living with rheumatic heart disease? It was seeing patients firsthand?
Yeah, definitely. Yeah.
And it's really surprising, actually, just hearing you talk about studying at university and that, rheumatic heart disease not being mentioned. And it was only until you went out into the field that you actually saw that firsthand.
Yeah, no, it's quite scary, even though rheumatic heart's quite big around here. But yeah, I'm just glad I know about it now, and that I can put my studying to good use, I guess.
For people who might not be familiar with rheumatic heart disease, can you just give us a little bit of a quick or brief explanation around what that is and sort of how it forms?
Yep, so rheumatic heart disease. So you have rheumatic fever, which is what starts when you have either a little sore that you've scratched that's become infected, or a sore throat that has the bug called streptococcus. So it's just the recurrent of this infection that makes your heart get sicker and sicker. And if you don't treat tonsillitis and it keeps coming back, your heart's just going to get sicker and sicker, until then you go to the doctor and he's noticed in your heart your valves leaking because of all the damage your heart's taken from the strep that hasn't been treated. So from rheumatic fever, you then get diagnosed to have rheumatic heart disease. But I think that's the easiest explanation. I hope that makes sense.
Yeah, it does. No, definitely. And there are people who, once they've had the rheumatic fever and it's unfortunately led to rheumatic heart disease, there are people living with that today. Do you see sort of adults with rheumatic heart disease coming to the centre, or is it mainly children you come across?
I have had a couple come through the clinic, but they no longer come to this clinic anymore, but it's mainly kids at this moment. A lot of kids have their bicillin until the age of 21, which they will go see Dr. Ben Reeves or after 21, it will be the adult cardiologist. And then they will just check on their heart to make sure his valve's closed or it's looking good. And then they'll determine whether or not they need more bicillins.
And what does your sort of average day in a life look like for you? What are some of the tasks or responsibilities that you undertake? You spoke a little bit about the injections that you administer for some of the patients. What are some of the other things that you do in your day-to-day?
So every day is different. It just depends, is at school or what kid walks through the door. Like some days, like today, I did 5 bicillins. So it's just, and then another day I won't do any. So it just kind of varies my role. I do a lot of immunisations every day, a lot of dressings, wound care, a lot of hearing and vision screening. I take the kids to the dentist every Thursday and Friday.
And when you're seeing, your patients every day, I imagine you'd build this really great relationship with the students there and have a strong connection, I guess. building that trust and that relationship for them to feel safe and comfortable to come to the doctor, to come to the dentist, which can sometimes be a scary place to be, especially if, you haven't grown up accessing those services.
It's definitely very tough to build the first relationship and get the kids' trust. But I found it was quite easy because a lot of the kids see me as they think I'm a schoolgirl. So that was kind of an easier way to, oh yeah, I'm your age, let me talk to you about your health. And then they started to see me as their like big sister. So it was kind of, okay, well, they see me as their big sister. Let me try and help them realize their health is important. Let me educate them and help them to be able to look after themselves and give it back to their family and community.
Yeah. And when it comes to, needles, actually, when you're thinking about needles, sometimes they can be a really scary or frightening thing for children. How do you sort of convince them or make them feel comfortable that it's going to be okay, especially when they're having, their bicillin injections? You have sort of some tricks?
So every kid is different. Some kids, they're not scared of the word needle, or they see the needle, they don't worry. Whereas some other kids, it could take me near an hour to do the needle. I've had to give kids the green whistle, just makes them a little bit dopey, so it puts them out of their misery. They still feel it, but they they just feel a bit more relaxed. A lot of kids, I do the amla cream, which is a numbing cream, so it makes it a little bit less painful. And a lot of kids, I bribe them with Tim Tams. So
no one will say no to chocolate or biscuits.
No, that's it. So I said, let me jab you and I'll give you 2 Tim Tams. So that seems to work most of the time.
Love it. And people that might be listening who are new to getting bicillin injections, what are some of the things that they can expect before or after an appointment? Can you sort of walk us through that?
Yeah, so the first appointment, I'm just thinking about my last bicillin girl. She's never had bicillin, and we was with her for quite a long time, but we just talked her through it. Yeah, I think just talking them through it, just making sure that they know what's about to happen, give them step by step of what's going on, when it's their first bicillin, and if they're not used to it, I do the ice pack, the amla cream, and I leave it there for at least 20 minutes. So it's not as painful, but the anxiety around it, because they look at the needle and they're going, oh, that's going inside me. And I just say, it's okay, just take a deep breath, it'll be over before you know it, and just kind of keep reassuring them throughout the whole appointment. And then once it's done, they're like, oh, I didn't feel it, or, oh, that wasn't too bad. So I feel good knowing that I didn't cause them too much pain, even though I scared them for nearly an hour until I did the needle. But yeah, a lot of these kids are really good.
And is there sort of some symptoms afterwards that people should look out for, or if they're experiencing sort of what are the symptoms to look out for afterwards if they're feeling a little bit abnormal, or is there anything that people should be looking out for and not to feel worried about, I guess?
Like the kids that I've given bicillins to, none of them have come back and said, oh, Jayrahni, this is hurting or this is happening. I've never had anything. Like they do have a sore bum, but they say it's gone by the next day. Nothing I've seen personally, no.
The process is relatively smooth. Right. And in the community, we spoke a little bit about Ngak Min Health and, where it's located. How important is it being an Aboriginal nurse and health worker to the work that you do and supporting your patients?
I think it's important because they feel a connection. I guess if I tell them that I identify as Aboriginal and Torres Strait, then they kind of just relax a little bit, I guess. Whereas like a non-Aboriginal Torres Strait Islander person, they put up a fence, I guess, because they haven't experienced or they don't know what it's like to live the way that they do.
So it's sort of that connection and the understanding. And I imagine that would be really helpful too for parents as well that come in and, sometimes you might go to mainstream services and they haven't had a great experience. So coming to a centre like Ngak Min Health would really be like a safe space for them.
Yeah, absolutely. Yeah.
And is there sort of, any cultural considerations or sensitivities that you apply in your work that kind of sets you apart and Ngak Min Health apart from other service providers that work at Ngak Min Health? Is it majority Aboriginal and Torres Strait Islander people, or is there sort of a mix there?
Definitely a mix. When I first started, I was the only one that identified in the clinic. So we've definitely grown. But yeah, we do have a handful now that identify, which really helps. Like our front receptionists, they both identify, which that kind of gives the kids a bit more, they feel safe, that they're being greeted by someone who they can call auntie and yeah, it's just a welcoming feeling when you walk through the doors at Ngak Min. But yeah.
Yeah, I think that's really important. Like even just seeing a familiar face there at the front desk just could, sort of ease all that anxiety or the worries that little children or their families might have. So we've spoken a lot about some of the great work that you've done. Have there been any unique challenges or situations that you've come across through your work, or even some sort of, I imagine that there would be some maybe heartbreaking in a way situations that you've come across in the line of work that you do?
Yeah, I think the biggest challenge is the communication between Ngak Min Health and the other clinics back in the kids' community, where like if I needed to contact one of the clinics to say the kid will be coming home, he's due bicillin, like the communication breakdown is quite poor, and I wish that it was better, especially for these kids. My biggest worry is once they finish year 12, what's going to happen, because I'm not going to be chasing them up to do their bicillins. It's the clinic's responsibility. But then I just feel they haven't had a bicillin for 4 months back at home. So it's just, I think that's the biggest challenge.
And it's really important, as we were talking about before, it's a really important part of treating rheumatic heart disease. And yeah, that sort of what can happen if you're not getting those injections frequently or on time.
Yep. If you stop getting your monthly bicillin, your heart will get very sick. Your joints will start to become sore. Like some kids know when their joints are getting sore, they're due their bicillin. So some kids will come, Jayrahni, am I due my bicillin because my joints are getting sore? Or yeah, they just become really sick, or they're getting sore throats, or their sores are just not getting better. So it's very important. And then some kids get to the point where they haven't had a bicillin for a long time and they end up having open heart surgery to replace the valve in their heart.
So it's almost like they'll get those signals from their body, asking for help, really.
Yeah. And then it's just whether they have the access to the clinic at the time, or whether they've got the transport to get to the clinic. Like these remote communities, clinics are very far away. It's very serious.
Definitely. How do you think we could get better at addressing some of these situations? Like when kids are going back home, after they've finished their schooling, if they've been boarding at the college, what are some of the solutions that you think that could help address these issues or make it easier for young people to stay on top of their treatment?
Oh, I wish I could go to all the communities and give every kid their bicillin, have like a big RHD bus that travels around Australia every month just to give all the kids. I feel like that would be the most successful solution.
I think it's something as simple as access for people who live in big cities that we take for granted can change your life, dramatically. That's sort of what I'm hearing from you, from the work that you've been doing and what you've been seeing there on the ground.
Yeah, for sure. Yeah.
And is there sort of any success stories or stories that have been really wholesome that you've seen through your work at Ngak Min and changing the lives of people who are living with rheumatic heart disease?
Yep. So I remember we had this one little girl. She was on bicillin from the time she could walk, I think. And she was a regular bicillin. She was always on time. She did have that time when she was worried about a boy, so she missed her bicillin. But now she no longer requires her bicillin. So it was really nice to hear Dr. Ben Reeve saying, oh, you no longer need your bicillin, but I'll see you in a year just to make sure your heart's still good. That was an emotional day because I just felt, I've jabbed you so many times and now I'm not going to jab you anymore. So I hope, she's doing good.
And you know that your work's been done there, hey, when you hear stories like that?
Yeah, most definitely.
Oh, that's so beautiful. And would you say that's sort of rewarding parts of your roles, seeing those transformations?
Most definitely, yeah.
Have you seen a lot of them over the years? Or
no, I think she might be the only one because a lot of them I won't see once they turn 18 because they're no longer at Djarragun. And whether or not they continue their bicillins back home, I'm not sure.
Yeah, wow. So that one really stuck with you.
Yeah.
That's beautiful. And is there any sort of, when we're talking about managing your own health for young people or parents or families with someone living with RHD, what sort of stands out to you, or what's the most important factor that people should be thinking about when they're managing their own healthcare, especially when it comes to RHD?
My biggest advice would be just go to the doctor for a checkup. Even if you don't know, if you have nothing wrong with you, just go for a checkup, because the more you get checked up, the more you're going to know you are okay. Keep up with your monthly bicillins, because at the end of the day, they're going to save you from being on an operating table and help you live a longer, happy life. Even though it's the most scariest needle to give someone, I believe, it's definitely the one that's going to make you better and your heart better.
And I think the other point that you raised about the symptoms of rheumatic fever, even if people are starting to feel a little bit off or they're having some of those symptoms, to go and see the doctor so you can treat it early.
Yeah.
Would you say that as well?
Yes. You know your body. So just once you start getting those symptoms that you know in your heart that it's your rheumatic playing up or something, just go to the doctor.
Yeah, thank you so much, Jayrahni. We've come to the end of the podcast. That just flew by. I feel like we only just got started a couple of minutes ago.
I'm glad it's over.
Oh, you did wonderful. Thank you so much for joining me. And is there anything else that you wanted to say before we wrap up to any young people or their parents that are living with RHD? If there's any sort of message you want to send out?
Yeah, I just want to say to the kids that have RHD and the parents that go to all the medical appointments with their kids, it does get easier. One day you'll never have to go to another hospital appointment because your kid's heart is healthy, because you took them every day for their bicillin or to the doctor's appointments or to their specialty appointments. So I just want to say it does get better. So just keep doing all the good work.
Thanks so much, Jayrahni, and thank you for all your work and your dedication to changing the lives of so many people in your community, and very, very grateful for the time that you spend doing that, and love your work. Keep it up.
Thank you so much.
If this episode has brought up anything for you, or you need some advice or guidance on yours or your family's CHD journey, you can call the HeartKids helpline on 1800 432 785. To access more information and find out more about the support HeartKids offers, visit the website at heartkids.org.au. The information in this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect yours or your family's health.